All right, welcome everybody. We're going to go ahead and get started. This is a reminder, this is our last ECHO session for the year and also the last session in this format. So again, we're going to merge with the other SUD ECHO that we have that meets on the second and fourth Mondays from 4 to 5 p.m. Information, we'll talk a little bit more about it at the end of the session as well. And then there'll also be a couple of communications to this group with the recap email, and then also for the other SUD ECHO, how to get signed up. It is very easy. We are just going to forward you calendar invites for those sessions, but we'll go into a little bit more detail at the end. But first, we're going to have a educational presentation from Jenna Mosley-Loans. And we'll have her unmute and go ahead and introduce yourself and share your screen. So go ahead.
All right. I'm going to share my screen. Okay, can everybody see it?
Yes, we don't, it's not in the presentation mode, but we do see the slides. There it is. Now we got it.
Okay. Great. Like Jay said, my name is Jenna Mosley-Lones, and I am a senior therapist with Healthy Minds here at WV Medicine. I know Amanda Newhouse was slated to teach today, but she couldn't make it, so she asked me to do it, and I'm happy to be here. I work primarily with children and adolescents and families, and I've been doing so for about 4 years now. And the topic for today is building a reflective capacity for parents with substance use disorders. I'm going to try to keep it to 30 minutes, but Jay, if I'm going over, just feel free to give me a 5-minute warning. And if people have questions, feel free to put those in the chat or save them for after, and I'd be happy to answer them or to lead us in a little discussion if there's time for that. Okay, we're going to get started. So today the agenda is pretty simple. We're going to define some terms so we're all on the same page. We're going to talk really briefly about parenting with substance use disorder, and then the bulk of the presentation is really about the skills around building reflective capacity, and then at the end some reflective questions. Just if you forget everything, you at least have some questions that you can take away that kind of lead us to more reflective thinking. So reflective capacity, that's what we're talking about today. What does that actually mean? Thinking reflectively, ideally, at its most ideal, is when we are able to take an experience and kind of externalize it a little bit and reconsider that experience, what we were thinking and feeling, in a way that deepens our understanding of both the experience and ourselves. And it offers some new meaning to us. So this takes skills, it takes time, and most of us, even at our healthiest, are not very good at it. And one of the big things is we haven't practiced it, but it also takes time. And who has time to revisit an often painful or uncomfortable experience? It's not usually what we want to do. We need some nudging. And this is true for the parents we work with as well. So when we're reflecting on an experience or a feeling or a thought, ideally we're doing this in a way that is curious, that's non-judgmental, and that is hopeful and instructive. This is kind of at its ideal. An example of this, kind of a silly but real, potentially real example is, so maybe I'm having a conversation with my friend And she shares that, guess what? We're going on a Disney cruise for the holidays. We're just taking off. It's a surprise for our kids. Oh my gosh, I'm so excited. I don't have to do anything. We're just taking off and leaving. So, outwardly, I'm going to be like, yay, congratulations. That sounds awesome. But inwardly, I might notice a little bit of must be nice to get away. Like, must be good for you to just take off. I mean, Christmas? Who goes away for Christmas? That's a little weird, but sure. So there's something else there. Normal us, I would just plow through, kind of forget about it, carry on. If I'm feeling super healthy and reflective, I may hang out there a little bit. And that's what we're going to practice today is, okay, sure, I'm happy for my friend, but there's something else underneath there. I'm going to be curious about it. What's going on for me? Okay, I love my friend. I'm happy for them, but man, there's something that's just annoying me. And okay, I think I'm feeling jealous. Blech, that's such an ugly emotion, but I'm not going to judge myself. I'm just going to hang in there. Okay, I am jealous. What's going on there? I don't even like Disney. It's not my thing. The kids are too old for that. I don't want to go on a cruise. What am I feeling jealous about here? Okay, it does sound really nice to just get away. I love the idea of not being responsible for all the magic of the holidays. Okay, yep, I'm exhausted. I'm a little bit overwhelmed with the pressure of getting it all done. Okay. So I could keep going, but you can see how by staying with the and being curious and not judging it can offer us some hope and some instruction on what we might need to do to take care of ourselves or to offer some relief. That is reflective capacity. Again, it's a hard ask. So how do we get there? Our reflective capacity depends on if we feel safe and if we feel connected. Some of us can do this for ourselves, like what I just did a little monologue, but most of us, most of the time, it's really ideal if we have someone with us helping us through this process. And that's where we come in as providers. We're hoping to guide people through this reflection in a way that helps them feel connected and safe because we are warm, consistent people in their lives. And so we're not just holding that space, we're also going there with them and helping them feel connected and that we're in this together. I'm going to be curious and empathetic and attuned to their experience so I can really understand what they're going through and help them reflect on what that is. Reflective capacity builds on our sense of attachment, feeling safe, and our sense of feeling understood, which is the technical word is intersubjectivity. And these are both really early childhood experiences of caregivers who are attuned and moving with their young children. So if someone has not had this in their early childhood, their ability to reflect is going to be undermined. This leads us to obstacles. A lot of these are pretty obvious. Lack of experience and practice with people modeling reflection and giving us that experience to reflect on our own stuff. We can talk about reflective capacity all day long, just like we could talk about playing the piano all day long. It will not improve our ability to play the piano or to reflect. We have to actually experience it in order to do it more and more. So we need to experience to grow that muscle. Things that keep us from reflection, Big emotions. If we're outside our window of tolerance, then we don't feel safe and we cannot ask somebody to reflect. It's just not appropriate. First, we have to calm ourselves down. These last two stand out to me, especially with the populations we're working with. If we have a history of feeling dismissed, especially by the people closest to us, our caregivers, our partners, if we have not been taken seriously and have been really dismissed and ignored, it is really hard for us to take ourselves seriously and to go there to that reflection. Because what I find is that that person spends so much energy um, identifying why they're entitled to their feelings versus how to understand their feelings. And that's a pretty big distinction. And that defensiveness keeps them from really kind of going to, okay, I'm feeling this. I'm not going to judge it, but I'm going to try to understand it. And also, similarly, the narrow self-concept. If we have a pretty rigid view of ourselves that is narrow, and I'm thinking of someone who's like, this is just who I am. I'm honest. I say what I say. I mean what I mean. And this is just who I am. Again, it makes so much sense if we look at some of the ways people have had to cultivate this identity to stay safe and protective. But those defense mechanisms are often obstacles to reflecting more into that kind of flexibility. So for the parents that we work with that have substance use disorders, I think it's safe to assume that for many of them, reflection has not been modeled and has often been undermined because 80% of women with substance use disorders have experienced trauma, and it usually undermines their sense of feeling safe and connected, right? Trauma is kind of the opposite of that, especially if it happened with caregivers. Maltreatment, loss, exposure to violence, all of those really limit our window of tolerance, so that often we see parents who are having very loaded reactions to their kids' behaviors because they are loaded, right? They are triggered by their aggression because they've experienced aggression, or they're triggered by their dismissive, disrespectful attitudes because of stuff that's happened in their past. And it's really hard to go towards reflection when you just have so much going on in that moment. And then, of course, why would you revisit that? There's a lot of shame. Well, as providers, it really is our job to help parents engage and expand their reflective capacity. And I would argue strongly that maybe aside from rapport and trust, helping and modeling reflective capacity with parents is up there. It's really essential. And in fact, if you do like a literature overview of therapeutic interventions that are evidence-based, reflective capacity is in all of them, and it's really key. So if we don't feel particularly good at this, I know this was one of my goals when I was starting off, is like, I'm not good at asking reflective questions. I really want to be intentional about that because it's not a skill we can afford to not be effective at. So how do we do that? That's a great question. There are a lot of tools out there. They're just reflective questions. My favorite, hands down, is PACE. And it's an acronym, and it comes from dyadic developmental psychotherapy, which is a dyadic model that works with caregivers and kids. And it was developed by Dr. Dan Hughes. But a lot of people pull from it, like they don't do the full DDP thing, but they use PACE. And PACE is really central to this intervention. And it's, in short, it's a tool to help parents and kids reflect. And it does this by structuring the way we communicate in a way that helps people feel really safe, and it's disarming and connected. And the goal for this self-reflection tool is to acknowledge the surface behavior or the surface problem, acknowledge it, and stay with it as we reflect and get to a more core issue. So surface behavior with kids are often defense mechanisms. The prickliness of parents, defense mechanisms. And we're going to use this tool to kind of drill down and get to something that's deeper and more significant and underlying what we're actually seeing. So in order to do this, the acronym is playfulness, acceptance, curiosity, and empathy. You actually usually start with acceptance, curiosity, and empathy, and the playfulness is just kind of sprinkled in as appropriate. Sometimes it's not, but if it is, go for it. The playful attitude would be like a mom who comes in and is just like, my kid is the worst kid and I am the worst parent. And you're like, oh, so we're going for the worst parent award. Okay, a lot of people are going for that these days. I think I've actually tried out a couple of times. So you're just kind of adding some lightness, and the playfulness, the big thing about playfulness is that it diffuses shame. We can talk about this. We can talk about how you're the worst parent in the world. I got you. This is totally a topic I want to talk about. It helps maintain kind of a lightness to heavy conversations. Again, as appropriate. But really the meat of it is the acceptance, curiosity, empathy. Acceptance is a lot of nonverbals. It's the provider feeling calm and relaxed and going there with the patient. And it can be a lot of, okay, The nonverbals are actually really important. The acceptance, I think, is the toughest part because often we're hearing like really maybe inappropriate things, inaccurate things, hard things, and we're not necessarily validating those or saying, yes, that's good. We're not approving of them, but we are saying, okay, I got you. Thank you for telling me this. I'm listening. Okay. Curiosity or empathy. We'll do curiosity first. Curiosity is really key to curiosity is the non-judgmentalness. It's same with acceptance. And this is going to diffuse the defensiveness that we often encounter with parents and children. I'm not going to talk to you if you don't know me. So as we are accepting and curious, it really helps diffuse that defensiveness. Curiosity is not fact-finding. It's rarely asking why. It is a tentative wondering out loud. I wonder what this was like for you. I wonder what this experience meant to you or what it felt like. Empathy adds kind of the whole body experience to it. You are connecting to what they're feeling. And especially with kids, but with parents too, you are matching the vitality of their feeling. Not necessarily the emotion, but the vitality. So if a kid or a parent comes in and is just like, I just can't even with my kid right now, you're not going to go, oh, thank you for telling me that. You're going to raise your energy to meet theirs like, woof, you are fed up. Man, this must have been a day for you. Tell me what that was like for you. You meet their energy. while being kind of in control of your own emotions and not necessarily sharing that emotion with them in a literal way. Using pace and curiosity in a way that is non-judgmental, accepting, helps the person in front of you feel settled and calmer, maybe even a little more soft and vulnerable. And that allows them to go into a more self-reflective place, right? And that curiosity is pulling them away from their emotions and maybe their amygdala, if they're really dysregulated, into their front part of their brain. Like, let's be curious about what this was like for you. We're not trying to fix things in this moment. We are just trying to understand them. So the PACE approach, we use first with parents, and we model this. So when they're sharing stuff of how their parenting is going, what feels hard, what feels good, we're using this approach with parents so that they feel safe and connected to us. And we're using this before we go to any sort of correcting or fixing. So we're connecting before we're correcting. Again and again and again. And then we're also asking parents to use these same tools with their children to connect before they correct. For example, this is a slide of a parent who's responding with PACE. So the kid has a really hard day at school and their teacher called their mom and they know they're in trouble and they come home and they're just like, maybe they're the angry kid, not the shut down kid. And they're like, oh, I just don't want to be here anymore. I hate school. I hate life. They're ready to fight. And you can see that in her face in the first slide. When a parent responds, a parent's go-to could be, this is easy to imagine, like an exasperated, ugh, I just can't with you anymore. You do this all the time. I've told you you cannot behave that way at school. Go to your room, right? Exasperated, trying to shut it down. Or maybe a parent has more of a fix-it attitude of like, you don't want to be here. That's crazy. Like, I love you. I want you here. You know that. Like, can we talk about this, please? Like, what can I do for you? More of that fix-it mentality. A PACE response would be a slowing down of, you don't want to be here anymore. Oh, that's been terrible for you. This must have been an awful day. You're allowing for the child to feel what they're feeling, and you're curious about what they're experiencing. You're not shutting it down, and you're not trying to fix it. And you can see how first it kind of is like surprising to a kid, like, wait a minute, this is not the usual reaction I get. And then maybe some confusion and then some softening. And that's the goal. The vibe we're aiming when we use PACE and help a parent or a child reflect is, parent, child, you are not crazy, you're not lazy, you're not a bad parent, you're not dumb. You have good reasons to feel the way you do. And I really want to know what it's like for you. That's the attitude we're projecting. We are helping them name their experience with some textures and flavors and different dimensions so that we can then kind of tackle it. We're not giving up on the tackling it. If some of our parenting strategies are unsafe or are really not great ones, if some of the kids' behaviors are disruptive, we're still getting to limits and boundaries and better ways of doing things. But first, we're reflecting. I think we have time to go through an example. The visual here of a spiral, which I think is actually a better depiction of how to use PACE to get to reflection and to get to a core issue. So at the top of the spiral, we see the superficial behavior. And then we're using acceptance, empathy, curiosity, acceptance, empathy, curiosity, playfulness sprinkled all around until we kind of get to a core issue. And this is a very effective experience. You need to be kind of comfortable with feeling things and noticing body language and maybe even pointing it out loud and the shifts in energy in your space, because that's really going to give you a lot of good information. So if a kid is kind of looking down, usually that means there's maybe some shame there. And it usually means you're getting to something good. So you want to pay attention to that. So the example I want to use, I'm going to use a kid and not a parent. But I want you to imagine kind of the parent in the room, maybe. And the provider is modeling this, right? They're using this and how to communicate with their kid. And the parent is watching it. So a kid is kind of being forced to come to therapy and they do not want to be there. And their attitude is like, you don't know anything. You're the worst. Why do I have to talk to you? Right? They are angry. They do not want to be here. So if I'm using PACE, I would say, I might say something playful like, oh, you don't want to be here. Worst place ever. I can think of some other places, but I hear you. I hear you saying something accepting. I don't know anything. Hold up. I'm supposed to be the expert and you don't think I know anything. I wonder if that's a little terrifying for you. Like, I'm supposed to know things and you're like, nope, you don't know anything. So you're getting to some empathy. How annoying must that be? You're being forced to be in a room with people you don't trust and don't want to be here. What is that like for you? Tell me more. Right? You just kind of hang out. The kid's still like, ugh, just shut up. I don't want to talk to you. I don't have to talk to you. I'm going to be quiet. Okay. Go back to accepting. I hear you. You're being really honest. I appreciate that. I can handle that. Some curiosity statements to maybe try to engage the kid a little bit. I'm wondering what it's like for you to be forced to be here. What is that like for you? I hate being here. I don't know why I have to be here. I am who I am. Why don't they just accept I am who I am? Got it. You want to be accepted. Why are they trying to change you? That actually makes a lot of sense. I think most of us really want to be accepted and not feel like we have to change. And you can see how if you're able to kind of stay with the resistance, to keep engaging in a way that honors where the kid is at, we could get to a place where we're talking about acceptance. And so you don't want to be here. You just want people to accept you. Why do other people want you to be here? Because they say I'm a bad kid and I do X, Y, and Z. And now we're getting to some really good stuff. Oh, they think you're a bad kid. Oh my goodness, I can see why you'd be angry. And maybe a little hurt. You just keep exploring and staying with them. Notice I'm not addressing behavior. I'm honoring where they're at, and we're staying with their experience. And the goal is not to figure everything out, but what is this experience like for you right now as you're somewhere you do not want to be? Let's honor that experience and learn more about it. And finally, these are just some reflective questions and statements that I find useful if we're just trying to move beyond kind of fact finding and figure out what happened, but we're trying to help the parent or the kid them think a little bit more deeply about things and go inside. What is your gut telling you? I love asking parents that, and often they'll say, well, I don't know if I knew that. Like, okay, let's listen. Let's just explore this a little bit. And there can be, your gut might be telling you lots of different things. I want to hear that. I wonder what was going on for you there. Is a good one, just kind of open-ended. Let's explore that. Does this feeling or experience feel familiar to you? This is a great one, especially with parents who are maybe, in my case, they're there because their kids are struggling in some way. Almost always it's a yes, like when they feel defeated, or if we're talking about, okay, you really lost it there, right? Like that behavior drives you nuts. When your kid is disrespectful to you and acts like you're not the boss, that just drives you nuts. Okay, is this familiar to you? Almost always it is. It's a, ugh, yes, it reminds me of when X, Y, Z would not take me seriously, or when my partner called me X, Y, and Z. And that is great reflection to have for them to understand that their parenting is loaded as it would be, and we can begin to unpack that. I believe you. Can you tell me more? This is great for kids. It's okay to not know. I got you. You don't have to have the answer to this question. I got you. It's okay to not know. It takes courage to be honest, and I'm so glad you're saying it out loud with me. It was a really nice, accepting statement. Especially when they're feeling, if it's a really kind of defeated parent or child who are just really down on themselves, to highlight that strength. You're saying it out loud. Whoa, that takes a lot of courage, and that opens a little window for reflection. These are some resources that I really like. The first one is a YouTube training by Daphne Linder. She's a practitioner of DDP, and she has this specific workshop is on the deliberate dialogue, and it's all about how to engage parents and children in a deliberate way of talking and getting to the good stuff. And she uses pace a lot of, and she does a beautiful job of giving you way more detail than I did here. And then the last one is a podcast that I've really enjoyed. And if you search for Circle of Security and Kim Golding, those two episodes have a lot on increasing parents' reflective capacity. And I learned a lot from them. Okay, that is it from me. Let me stop sharing.
Thanks, Jenna. That was great. We really appreciate the resources as well. Make sure to get those out to everybody. Does anybody have any questions or comments? We've got time for a discussion, so feel free to unmute, put it in the chat, whichever is easiest.
Jenna, as you were talking, I was thinking about applicability to not just the dyadic work, but like family work and couples work. I don't know if you can speak to that, kind of generalizing the reflective capacity and the kinds of questions that you're talking about to kind of the family, working with families or couples.
Yes, I think it could be super useful. Honestly, I don't have a ton of experience with the couples piece. I kind of stay away from that. But the piece that I think would be really useful is the recognition that by using pace and self-reflection, the point is that the person's inner experience is valid. Whether it is accurate to the other person or not is not so much, that's not the point. The point is just to understand the inner experience. So, you know, when there's conflict between couples or conflict between parent and kids, especially with teenagers, when they're just like, that is not what happened. This is a good tool to get out of that power struggle and say, okay, we have different experiences, but let's explore each other's experiences and try to empathize with those different experiences.
Any other questions or comments? There aren't any, we'll move on to the next agenda item, but we do have time, so just want to make sure. But Jenna, we do appreciate taking the time to come here today and present, and we'll pass along any other additional questions or comments if we get anything after the session. So thank you again. So we don't have a case. We're going to use the rest of the time to discuss kind of how things are going to move forward here for the ECHO. So like we talked about, this was in November. We mentioned that this will conclude the project the way it is designed now. So this group will now combine with the other SUD group that we have that for Project ECHO. It's more of a general SUD ECHO. They cover a variety of topics. And so there is overlap in what is discussed in both ECHOs. So this just seems like a good way to merge the groups. Now it is a change of time. It is on Mondays moving forward in January, the second and fourth Monday from 4 to 5 p.m. The sessions will, although, run the same. They'll be recorded. There's didactic presentation, case presentation, questions, things like that. So everything will look the same. We will still have all the recordings of all the past PPW ECHOs up on our YouTube page. Those aren't going anywhere. You'll have access to all the other SUD sessions moving forward. And the biggest thing with as far as like how you'll join the sessions is that we will, after this session, you'll get a recap email that will explain a lot what I'm talking about now. And then you'll get a second email, which is the calendar invites for the sessions. They will include the Zoom link to join. There will not be the registration like we've had to do here in the past. So be on the lookout for those. If you have any questions, you don't get them, something like that, please don't hesitate to reach out. We will plan to meet again in January. The first SUD session in January is the 8th. So January 8th. And like I said, we're here to hopefully make it a seamless transition. So please let me know. I don't know if Laura, anybody else wanted to say anything about that, since Laura, you also participate in the other SUD ECHO.
Yeah, and I know some people currently on this call also participate in that, so some people are familiar with it. So I think it's a good opportunity. One of the things we like to do is hear from people about the kinds of topics they like to have discussed, want to hear more about. And so if you sort of look at the schedule for that ECHO and exactly what you want to hear about is not on there, you can always communicate with Jay and make suggestions about topics that you still want to hear. So we still want to incorporate kind of the PPW context and content, and we're just going to do it in the SUD ECHO.
Great.
Jen, I don't know if you want to say anything.
I just wanted to say thank you to everyone for supporting this kind of breakout series that we've had. and all the great questions and suggestions for content that have come out of it. I know on behalf of Marshall Family Medicine, we're going to fold in to the existing SUD ECHO. And please, as Laura said, if you have any questions or suggestions for content, please pass those along so that everyone can provide the content that you need for your daily practice.
Awesome. Thank you both. Excuse me. Thank you both, Jennifer and Laura. So be on the lookout for the communications after this session. If there aren't any other questions or comments, we will go ahead and adjourn. We will not keep you any longer than we have to. And we really appreciate your participation. We hope you have a great holiday season here moving forward, and we'll hopefully see you in January. All right. Thank you.